in conversation with Preetha Reddy from Apollo Hospitals. Thank you very much for talking to us on Money Control on the sidelines of the World Economic Forum here in Davos. I want to start by asking you about, what you're picking up on global macros. You've attended a lot of sessions. Clearly, geopolitics is on top of mind, given the number of presidents who've come this year to attend WEF fan address sessions. What was your key takeaway from WEF 2024?
I think there were a lot of takeaways, but on the geopolitics, it is a situation which we have. It is a challenge. It could blow up into something which is, quite alarming, or the world leaders will be able to contain it with the kind of thought process which leaders should be having. So I'm hoping it will actually pan out for the betterment. But having said that, this whole focus on climate change, I think, is important because we're actually a bit late. But if we take it up now, it's going to make a huge difference. It's a particular interest because the impact of climate change is directly correlated to health. And so unless that can be tackled, I think we will have an additional problem to health. I was, engaged with world leaders on Disease X and preparing for a pandemic if it has to happen. God willing, I think if there's a sense of preparedness around the globe, that we'll be able to at least mitigate that risk to some extent. So that was also, one of the events which took place. Having said that, I think the impact of AI was probably, down the promenade or in the Congress Center, at all the venues, the topic of what AI can do for mankind, for the way we do things, for productivity, for industry, and to a large extent for health and research also. And that was a real excitement because we can see a time where, using AI, it can overcome some of the challenges, challenge of access, challenge of even pricing and cost, and more than anything else of skilled labor. If AI can actually replace some of the challenges of not having enough people in the workforce, for clinicians to plan what they're doing in a more structured format, for them to anticipate what their diagnosis and protocols should be, and for surgeons to plan surgery in such a way that, the mishaps, the outcomes are even better than what we have today. So I think those are the positive outcomes, and we are hoping that every day there's a new win in the healthcare space. So I think that's been extremely encouraging. And I'm sure that the takeaways will be huge and we'll be able to implement things. And also the focus on women's health. I have to commend that women had such an important place and role to play at the table this time. There were conversations on how women in health research that the data shows that the women are not included as much as the men are. And I think that's traditionally, it's just happened. It's no one's fault. But there's a very concentrated focus on women's health, not just the routine ones, which is, gynecological and those kind of things, but in every aspect of what is done for new discoveries, new devices. And there have been some fabulous conversations.
Right. Coming to hospitals and healthcare itself, if I look at the hospital space, there is a renewed focus on bed capacity expansion. Not just Apollo, but other hospital chains as well have added sizable number of beds. And there's also a focus on building new clusters and geographical expansion. Apollo, for instance, I think you've acquired hospitals in Mumbai and Kolkata, and you're strengthening your presence in those markets. So can you give us a sense about, your growth plan, how you want to build your footprint in the market?
I think every responsible healthcare player will want to do more. And these markets traditionally, our brand is strong and it's been built over the years, and our clinical teams have been phenomenal. So we are expanding in Calcutta, in Mumbai, hopefully maybe in, more in the north, some more in the southern region, at least strengthen our forces in the southern region. So you will see a lot of Apollo expanding.
Right. Any numbers you would like to share in terms of investments, bed capacity additions for the next fiscal?
I think not here.
You were saying that you are going to expand at a pace and that you will grow your presence in other markets. I also wanted to ask you about an interesting trend we've seen in the last year where there's a lot of investor interest in the private healthcare space in India, particularly from private equity funds. What will that mean for the healthcare space? Is it a good thing because we are seeing so much of investor interest? Will it increase competition? Will the cost of healthcare go up because we are seeing so much of private equity money coming?
So let me start with saying that the cost of healthcare is an input cost. So, you have to really pay for materials, for manpower, and for infrastructure. So those costs will depends on how much, if we can get better options, we will. So it's not really about private equity coming in, which is going to impact costs because, we have a responsibility to provide healthcare at the right cost. But private equity coming in is good simply because there's so much more infrastructure which needs to be built. We still don't have enough hospital beds. And if they come and the infrastructure grows, I think it's good for people. We need more hospital beds. There's data to show that we don't even have 30% of the required hospital beds, which a country of our size needs. So I think it's a good thing because we need investments in healthcare. And the sector will grow, which, globally, that's also happening.
Increase competition.
Not really, because the number of people who have to be served is huge. The competition is about getting good, high-quality, adequate manpower. And if you have those, then you can deliver that kind of care. So I would look at just the number of beds or others coming up, bigger, because there's still, the requirement is huge.
Right. Finally, ma'am, when we talk about AI, and you mentioned how AI is so visibly present this time at Davos, everybody also talks about the applications of AI in healthcare. Is this something that you're looking at seriously? How are you going to go about it? Have you set up a team to perhaps, conduct experiments on how you can have AI in different parts of your business?
I think AI has come to stay, let's face it. And it's so nice to see the amount of, new innovations which are happening. You just walk down the promenade and you're seeing so much of it. We are already using AI in one area which is doing very well is in our health checks. It's the Apollo Pro Health, and it's AI backed, AI driven. So it can actually predict your risk of getting any one of these major diseases. We've been using it, and people are very happy with it, and the numbers there are growing. In the area of diagnosis, when you do the scans, whether it's the MRIs or the ultrasounds, the AI is going to play a very vital role to help the clinician decide on accurate diagnosis. So that is happening in the pathology area. It's happening in telepathology and how you look at just the cancer markers. So I think in a lot of areas of healthcare, this is going on, and we will see more happen.
Right. On that note, thank you very much, ma'am, for talking to us.